Well, thank you, Dr. Jack Fu. Let's welcome Natalie Franciose. She received a Bachelor degree of Science in Biology and a minor in Chemistry from the Virginia Radford University in 2008. In August of 2015, Natalie earned her master's degree of Science in Chinese medicine from CSTCM. Interned and then hired at the Urban Herbs, a Chinese herbal pharmacy and clinic. As an acupuncturist, while opening her own clinic in Denver metro area, she is nationally board certified and currently earns her doctorate degree of acupuncture and Oriental medicine from Colorado Chinese Medical University. While walking the way of the past, Natalie has a calling to help others to unlock the powerful healing capacities they already hold within themselves. And today, her presentation will be the evidence-informed treatment of the EDS with the Chinese medicine. Let's welcome Natalie.
Hello, I am Natalie Franciose, coming to you from Colorado, Denver, Colorado in the United States. And I'm here to present to you the evidence-informed treatment of EDS with Chinese medicine. I am a licensed acupuncturist trained in traditional Chinese medicine and Oriental medicine, and currently getting my doctorate in classical Chinese medicine. What is EDS? It is Ehlers-Danlos syndrome, and this is a genetic disorder affecting the connective tissue. And this has underlying abnormalities in the synthesis of metabolism of collagen. The prevalence is approximately 1 in 5,000 births, equally presenting in males and females, but more symptomatically in female-born persons. There are 13 different types of EDS, and they are commonly misdiagnosed as fibromyalgia or chronic fatigue syndrome. And the criteria for their diagnosis is very specific because of its red herrings. They have common presentation of pain. That's the main presentation, so it can mimic a lot of different things. And so the first line defense for it on a Western front is non-steroidal anti-inflammatory medication, steroids, opioids, anti-seizure medications, and then any other secondary anti-anxiety medications that are accompanied with their needs. So it is an autosomal dominant, with particular the hypermobile EDS, which is one of the common diagnoses of Ehlers-Danlos syndrome. And it commonly presents with this hypermobility of the joints and the laxity of the skin. And underneath the microscope, the various subtypes look very differently. And those distinctions are made not only underneath the scope, but within these different presentations and these different abnormalities that are happening in the physiology. So you can see the different subtypes and the names: classical to cardiac, valvular, hypermobile, kyphoscoliotic, and so on and so forth. So we can see these different clinical characteristics and the different types. So the different facial appearances and the bone formation, maybe some defect in the feet or the appendages, excess or hyper extensibility in the joints, or nobular accumulations in the knees or in the thorax region. So what's going on inside the cell? What's the genetic and pathophysiology basis of EDS? So the endoplasmic reticulum is where the protein synthesis occurs. And so when there's dysfunction in that metabolic function, this is who's responsible. There's also the Golgi apparatus, who helps to process and package the protein and lipid molecules that are then exported out of the cell, exiting to further their function elsewhere in the body, the bloodstream, and so on and so forth. But they are not adequately processing their collagen synthesis here. And so what does that look like in a patient's experience? We've discussed the chronic pain being the main symptom, but it also is characterized by the joint hypermobility, hyperextensibility of the skin, tissue fragility, easy and prone to bruising, and there's scarification that happens. The musculoskeletal issues such as dysplasia, different bone formation, also hypertonia, hypotonia, a lack of tonicity, congenital or progressive contractures, vascular and viscera complications. And what is connective tissue? So the connective tissue is also known as the fascia network, and this is the housing of the nervous system. And we see many of the dysautonomia because of the dysfunction within the housing of the nervous system. So this tissue originates at the base of the foot and comes up and comes up off the sole of the foot around the heel, and it wraps around the bone, weaving through the muscles and around the muscles, and it weaves all throughout the limbs and within the viscera, within the organs of the abdominal cavity, and through all the joints, intercostals, and then connects at the base of the skull in the occiput. And so this wicker work and disorder of collagen, it offers such a challenge when there could quite literally be pain anywhere and potentially everywhere for people. This also, the fascia network, is where the meridians overlay. And so we look at where the meridians are mapped, and then we have overlaid that on the map of the fascia networks, and it completely aligns. So it's no wonder that acupuncture is and can be supportive of the fascia networks and disorders of the connective tissue. So let's see, how does Chinese medicine take on this? What is its diagnoses? So the deficiencies of this connective tissue function relates to the deficiencies of the qi, and the qi of many different systems. It could be any of them: the spleen, the kidney, the heart, the lung. It could be the jing, the yin and yang, particularly the liver yin, and potentially a liver qi stagnation and or Shen disturbance. So what is qi, and what's its job? So the qi has many duties in the body. And one of the jobs of that the liver has in Chinese medical theory is it is in charge of regulating smooth flow of qi. And when it gets stuck or bound up, it often manifests as pain. And so we call that qi stagnation. Things are stuck. And so we need to move gently, move that energy through so that there is flow, smooth flow. Another job of the qi and its function is the responsibility for holding blood in vessels, which is the heart and fire system, holding bone in the matrix and or brain in the housing. That's the kidney and the water system. Its job is holding muscle tone and strength. And that qi is the spleen and the earth system. Its job of holding sweat in the pores and skin in place. This is the lung and metal system. And then the tendons and ligamental function is predominantly attaching the muscle to the bone. And this is a duty for the liver and the wood system. So we see EDS patients having a vital substance imbalance, and to which one it is dependent on the patient's presentation. And this is how we diagnose, and differentiating between which systems are imbalanced. So whether it be a qi imbalance, a blood imbalance, those body fluids, that dryness is a real telltale hallmark. The mind is the shen, the spirit of the heart connecting to the mind and the heavens. Huge component for those mental illness or mental disorders, and the essence and the jing. So the pre-heaven, the post-heaven, and the kidney essence all going into the jing. So the connective tissue has a relationship to the wood and earth systems. And there are 3 jiaos in our body, or burners, and the upper jiao is connected to the lungs and the heart. The middle jiao is the spleen stomach. Spleen is synonymous with pancreatic function, and the liver gallbladder, and that's the wood system. And then we have the lower jiao, which is the large intestine, urinary bladder, kidneys, and we're going to zoom back to the middle jiao while we discuss this. The connective tissue has the relationship between these 2 systems because they have a metabolic function. And the wood is the liver, gallbladder, earth is the spleen, stomach, as we said. And if one has more muscle flaccidity, this is signifying an earth imbalance, that lack of tonus and strength and development of tissue. When one has a tendon hypermobility, this will signify a wood imbalance. And whether it is an excess or a deficiency, a deficient pathology will give us information on, okay, is it excess? Is the qi or the blood stagnant? Is there stasis happening? Is something really stuck? Or is there a yin and blood insufficiency? And quite often there could be both. So this leads to complexity. So what is this essence deficiency? What is this substance? So when we see a patient with essence deficiency, there are constituents to take into consideration. So the pre-heaven essence is the genetic material that we get from our parents. from in utero, right? And then we consume the food, which is the post-heaven essence. And this is how we gain, we eat the food, we ingest it, we transform it in our middle jiao, in the spleen stomach. And then it's disseminated into qi and how we gain strength, nutritive value. And then we have the kidney essence, which in men, it is the sperm and the semen. And when women, it is the menses. And these three components equal the Jing essence. And when there's an essence deficiency, patient will present with late closure of the fontanelles, mental fatigue, restlessness, mental delay in development, an uneasiness, potentially loss of hair, early loss of hair. We'll see this losing teeth, lack of strength in the gums, the insomnia, poor memory, the bone development, not just in the facial structure, but all over. There may be softening or graying, soreness of the back and the knees, and a weakness of sexual activity, potentially low libido, and dullness, dizziness, and potentially in the pulse will feel floating, empty, and rapid, and the tongue may look like red with no coat. And depending on if other things are going on, that's a good nutshell. So how can Chinese medicine help, right? It's beautiful at balancing this yin and yang to harmonize Jing, Qi, and Shen. And in EDS patients, there is a preponderance of yin, and this will be the more lethargic, fatigue, weakness, flaccidity, deformation, and degeneration of the tissue. And if there's a preponderance of yang, there'll be more red, excess heat, stagnation of qi, pain, irritability and anger, and maybe this anxiety and insomnia, this Shen disturbance of energy is rising and then getting stuck. So we can use these treatment principles in my clinical experience. These are the methods that I have utilized with acupuncture for the various diagnoses. So you want to make sure you diagnose appropriately so that then you can treat effectively. And taking a look here, you'll notice many of them have a lot to do with the essence and the kidney energy. Wonderful along the Ren or the Du Mai channels. And if you look in the right column, the liver qi stagnation for excess pathology, gallbladder 34, very nice. For that is the influential point for sinews and tendons. So very, very helpful if people have those issues going on. So my first case study is of a female born in 1983. I treated her about monthly for about 2 years, and chief complaint was body pain, chronically rolling her ankle, low back, knees, dull and achy, presentation that came and went, and worse with pressure and movement. Now, if there is pain that is worse with movement, that signifies to me is a deficiency, because that says they didn't have enough qi and they moved it and it got worse. So they didn't have enough to sufficiently move in the ways that the body ideally will. And it's different than an excess where you move it and it felt so much better, right? Oh, it feels so much better after I get a little flow going. So immediately I'm thinking, okay, we have some deficiency happening. So she's diagnosed with hypermobility EDS type 4 POTS, mast cell activation syndrome. She's very cautious while getting body work and has a care team with a chiropractor, kinesiologist, and a physical therapist. Is cautious when she gets her body moving and getting body work. She also has chronic low energy and stress and floaters with vision loss and some hearing loss due to a sonic TBI. She wakes throughout the night, has anxiety and palpitations, with those exacerbated when her husband is out of town. She's rearing 2 children, one of which has EDS, and has been diagnosed with IBS and regular menstruation and brain fog, alternating hot and cold, kind of some thermal dysregulation going on. This woman had a very thin and small frame, thin bodies, pale pallor. And the most significant pulse, I had been treating her here in the beginning when I had my TCM training. Biggest significance was the large heart pulse and the weak guans, both earth and wood system. And the churs were both thin and thready. So this tells me, okay, there's some kidney deficiency and the middle jiao is weak, with the shen being disturbed. Yes. So I went about nourishing the liver and blood, tendons, and tonifying yang and spleen qi, and I gently moved qi to alleviate pain, opening the yang wei and chang mai, doing various unilateral points along the spleen, large intestine, move some qi, support the lung, UB60 and kidney 3, along with do 20 and 24. I also direct moxa. Direct moxa is so lovely. I chose liver 5, gallbladder 34, stomach 36, and I suggested doing a visualization to calm her nervous system, to think about trees by a river, nourishing wood and water. She liked that. The report after the first treatment was that she felt very nice and slept great with noticeably less pain. And I treated her monthly for about 2 years. And the last time I saw her, she came in on her moving week before she left the country. So she was not sleeping well, fatigued, lots of soreness, pain, and was coming off of having COVID 3 weeks ago. No symptoms, but lingering fatigue. So, and currently on her menstrual cycle. So the most significant pulse in classical Chinese medicine, we look at the most significant pulse, the significant change, or the most insignificant. And this day, she had severe metal deficiency. So they looked to opening up the low point on the Ren channel, did Ren 15, to open and help open this thoroughfare, tonified via Tanya treatment, lung 8 and sedated Li5, and then tonified the kidneys as well, as they were weak and deep and thin, and I needed to support that water. So kidney 10 and UB40 with direct moxa for stomach 36, liver 3, and spleen 6. She reported feeling very good after that one too. So my second case study is a non-binary patient born in 1991, female born, and goes by they or he. So the chief complaint is migraines, chronic pain, especially in hips, and refers down legs, whole body nerve pain. diagnosed EDS, POTS, lupus, gastroparesis, and they have a very low appetite. Also has mental health issues with anxiety, depression, PTSD, autism, and history of suicidality. They have insomnia, chronic nightmares, and challenges sleeping. Had a gender-affirming hysterectomy in 2017 and a top surgery removing the breast tissue in 2023. Mobility challenges, uses an electric wheelchair, and upon first time seeing them, noticed the lack of tonicity and musculature on their legs. Tissue was very pliable and soft upon palpation, pale, sallow complexion, a bit kyphotic in the upper back, and they had dark circles under their eyes. The first treatment in August 2022 noticed very weak in the middle jowl, both earth and wood systems, and big in the Sun position in their heart. So I treated them as a yang body and did the Zhuangzhong for Ren 17 and 6, which is balancing their earth and wood system, 2 needles in 1 point. So opened their Dumai and then gave them Mingmen treatment with Sanjiao 4 and PC6. And their pulses felt much more filled out in both guans and smooth throughout in the Sun and Chur. They reported less pain and no headache. They felt calmer with less anxiety. In their most recent treatment in October 2023, again, pain as their chief complaint, mostly at the base of the skull, and anxiety. And they mentioned that they disassociate from their bodies when they're uncomfortable. So we want to support that Shen to come back into the body. And I gave them a Mingmen treatment and opted to give them some neuroacupuncture, needling both sensory and motor lines, along with the Sanjiao 4 PC6. They reported much less pain in the occiput, head and back, and felt better, less anxious. And then their pulses were very much less rapid and balanced throughout. So many complementary alternative medicines for EDS. And one of the big things is to convey to your patient that what works for one patient may not work for another. So the grace to work with you in their wellness path. A bunch of nutritional support here with vitamins, supplements, or you can get them through food. I find that the most helpful adjunct therapy is moxibustion, utilizing that beautiful Aya, mugwort, Artemisia vulgaris as a warming therapy. And it puts that yang qi into the body, which they're not producing on their own. They're not producing that from their metabolic function. So we put that in, and it's so soothing, that infrared light to offer that yang qi, and they like it very much, and supports the tensegrity of the connective tissue. So anytime people are getting body work, we want to make sure they're careful not to sublux, using gentle methods. If they are doing body work and massage, kinesio tape and bracing will help. TENS units, very helpful, low electrical nerve stimulation. Some gentle chiropractic and cannabis mindfulness practices, qigong, very nice. And the biopsychosocial impact of this, the genetic components, and they come in with this, and then how do we support them as they go, helping them with their complex physiology, and having them be cautious with their activities, not to injure and sprain and strain, but to make sure that they're getting out and moving and engaging with people, but supporting their psychosocial and physical well-being. So there's a study done in looking at the mental disharmonies that come with EDS, and the most predominant links and multi-diagnoses are autism, bipolar, schizophrenia, depression, and then attention deficit hyperactive disorder, ADHD. And so there is a beautiful opportunity to help the mind strengthen and to really encourage patients to be persistent and patient and stay positive for their mental well-being as well, and to listen as practitioners, for us to listen to them, to their story, and to validate what they can, because most often they have had horror experiences with medical providers that discount their symptoms or experience, and so much mental health really starts with someone listening. And sociological impact, it's really debilitating when you can't physically do things, right? Growing up, and you want to act and play and participate, but there's limitation, and continuing to encourage people to engage and relate with their peers so as to prevent isolation. This connection is so vitalizing for your patient's care plan. They have these limitations that disallow them to do things, but reminding that there are embodiment practices that won't harm. And if one is not on too many medications, you must look at what they're taking. They're taking pharmaceuticals, but if they are wanting herbal support, Chinese herbal support, very nice yin supportive formulations here, depending on what their diagnoses are. So must be accurate with this, and depending if it's yang or yin or lung or kidney, we can modify things. And then if there's more of an excess pathology and stagnation, we can give them more gentle moving, alleviation of pain. And you're welcome to combine these. And I would suggest going slow and low dose, and then see how they respond, and have follow up soon after giving them these herbs, and make sure they're taking them many hours after or before their pharmaceuticals. Thank you so much. This has been an honor. Appreciate you. This is my reference page, and take care. Be well.
The theory and the important for the erection of disorder is, and we know that acupuncture can be one of the great way, and the Chinese herbal medicine can be one of the great way, and the great evidence to show the acupuncture and the Oriental medicine, the Chinese medicine, can treat these 13 types of the erectile disorder. So I'm looking forward the success for Natalie in your clinic to helping more people for their quality of the life. And thank you very much for Natalie for this great presentation. Thank you.
Yes, the Natalie, like she said, she likes the unlock the powerful healing, the capitalists, she already did, because she seriously working on the research, and she seriously working on the help the people, and she very sensitive find it the certain different type the EDS, and she really introduced about the Chinese medicine and the Chinese treatment, acupuncture treatment and the acupressure treatment for treating with EDS. So thank you, Natalie. You are great.
谢谢。
So really seriously, the Chinese Qi, it's seriously help with a different problem. Even you just exercise with the Qigong and Tai Chi, that can help you some improve your body's health. And also, it's if you can drive the Qi, go in your system, use the Qi system, the acupuncture, that is everybody can looking for with Colorado University, the Song Tao Zhou, he introduced yesterday. They have the Qi system, the teaching. That is the first one, the system teaching in the university in American. So that is a great. And in the University of East Western Medicine in San Jose, used to we have the Tai Chi, the PhD, and that's the first one in the American too. So that is a really practice Tai Chi and Qigong can help you the Qi. Qi can help you the EDS too. And the acupuncture drive the Qi, especially Dr. Bo, the abdominal acupuncture. That's really very good for the EDS. Okay, thank you, Natalie.